there you see an opportunity for Fortis, I mean, in creating awareness about, lifestyle diseases. I mean, a case in point is the organ donation drive that you've launched recently. Do you see Fortis doing more such stuff, which is like preventive and education? And
I do. I don't think that organizations like ours, I don't think we have the right to exist if we're not contributing to the solution. So I'll give you an example. Yesterday, we had a rally that was sponsored by our La Femme brand. La Femme is a Fortis brand, which is to raise awareness on breast cancer. The unfortunate news there is that 6-7 years ago, breast cancer was the number 4, number 5 cancer in India. Today, breast cancer is quickly becoming the number 1 cancer in India. And so raising awareness for women in terms of getting tested, getting mammograms, and having basic education, understanding of how to detect breast cancer, or at least detecting potentially an issue there. I think that we have to do that. So whether it's cancer, oncology, whether it's from a cardiac perspective, we have nutritionists in our hospitals that we are working on to educate around childhood obesity, around the kind of diets we have. Our diets are very rich. And I think very often we assume that just because we're vegetarian that we're prone and that we're shielded, actually, we're shielded from any sort of maladies around the heart. But the reality is that, given a vegetarian diet that consists of pakoras and vada pav and all these other things that we eat, samosas, etc., and these dals with lots and lots of tail and etc., quite honestly, that's pretty bad as well. So I think that building awareness and again, moving towards having a healthier nation, I think that's in our best interest as well, so that we continue to build a healthier country as we go forward.
Let's talk about your recent drive on organ donation. I mean, 500,000 people die because of non-availability of organs. How do you plan to address this issue? I mean, of course, you're going to talk about the taboos associated with it.
So we've done we picked up organ donation as an organizational cause last year. It's been about 9 or 10 months now, and the first to attack the challenge, as you rightly said, 500,000 people die every year because they don't get an organ in time. The first order, the first mandate for us is to build awareness and to build the organ donor base in India today. So in the last 7-8 months, we have 16,000 employees at Fortis. Over 5,000 employees have pledged their organs, which is a wonderful thing. Our goal is to continue to grow that number. And then, outside of Fortis as well, it's continue to educate people, help build awareness around it, so that people realize that any one of us can be organ donors. And it's not just in the situation where, God forbid, something terrible happens to us. We have family members, relatives, that might need organs. That we should be aware that how we can help people and how we can give and still continue to live full, healthy lives on our own. So I think we're working on building awareness. We're working on educating not just our patients and attendants, but even our doctors, even our nurses, in terms of how do you have that conversation. So I'm very, very proud of what the organization's done. It's an organizational initiative. There's no commercial end to it. This is not, Fortis will not make one penny. This is not about it at all. It's really about building the awareness, because this is the kind of thing that an organization like ours, it's really interesting, that if we can get 5,000-6,000 employees committed, or if we can raise the awareness of 16,000 employees, and they tell 10 people who 10 people, it's very conceivable that in the next 3, 4, 5, 7, 10 years, that you could actually have 1 million people walking around, living healthy lives that otherwise might not be. And that's a very powerful thing, and we're very committed to it. And I think you can look to Fortis to lead the way in India with respect to organ donation and actually moving the needle on it. Because if 5 years from now, if 500,000 people are still dying, then we've all failed. And my endeavor, our endeavor, every one of us, all 16,000 Fortis employees, our endeavor is to make sure that that number changes.
Mm-hmm.